Okay, good morning. We'll give a minute to let everyone join the event. So we'll start right on time. Perfect. I think we can start. Good morning, everyone. Welcome to this webinar that we've prepared for you today. My name is Valeria Carvajal, and I am head of operations at Oversea in the U.S. I'm very excited to welcome LeAnn Born to our webinar today. LeAnn, thank you for joining us. Can you tell us a little bit about yourself?
Sure, I'd be glad to do that. Well, thank you everybody for joining us this morning. Morning where I am. I guess we could be all over the world at this point, but my name is LeAnn Born, and I am the founder and advisor of LeAnn Born Advisory Solutions. And in my consulting business, I advise suppliers, providers, meaning the health systems and hospitals, the group purchasing organizations, and other industry partners about the healthcare supply chain. My background includes a little over 3 decades of executive leadership in major health systems with their supply chain services. I've done group development with group purchasing organizations and provided guidance to medical suppliers on strategies to better connect with their customers. Prior to my consulting practice, I served as vice president of supply chain at M Health Fairview. It's a health system in the Twin Cities in Minnesota. I also worked as a vice president at Novation, which is a group purchasing organization known as Vizient these days, and also several different hospital and clinic positions before I stepped into the supply chain at Allina Health, again in Minneapolis, Minnesota. So glad to be here and joining all of you today.
Amazing. It's an honor to have you here. Thank you for the introduction. So on the agenda today, we'll be providing some market updates on transatlantic and trans-Pacific trades as we usually do on our webinars. Then we'll give you the latest status on tariffs. LeAnn will then tell us about supply chain in the healthcare industry, the challenges they're facing, some strategies in logistics, and how to navigate through the regulations. And then, of course, we'll have a Q&A session at the end to answer anything that might come up. Okay, perfect. So let's start with the transatlantic trade. We are seeing some tight spaces in Europe with anticipated peak season and many shippers trying to rush out cargo before the initial deadline on tariffs that was initially set for today, July 9th. Right now, shipping lines are not able to confirm bookings until the end of July due to this situation. On Monday this week, as you might recall, the White House announced an extension on the deadline for trade deals to August 1st. So shippers still have some time to get cargo before that, cargo out of Europe, I mean. Luckily for this trade, there's stability on ocean freight rates, so that's a good thing. On Trans-Pacific, as we have seen, the relationship between China and the US has built a lot of uncertainty on this trade, with volumes sharply slowing down. In May, we saw imports from China plunge. That was like 20% month over month compared to April this year, and then 28.5% year over year compared to May 2024. In June, what we saw is that volume stabilized slightly, however, not what was expected, with only 0.4% higher month over month, but still 28% below June 2024 levels. There will be further announcements on tariffs from China in mid-August, but they reached an agreement with Vietnam set at 20% down from an initially threatened 46% reciprocal tariff, and 40% to transshipments, mainly aimed at the ones that were routed via Vietnam from China. So with all the information we have been getting, let's see the status right now. What are the tariffs in place? We have a 50% tariff on all steel and aluminum and derivatives, with the UK being at only 25%, so that's the only exception. And then we have the reciprocal 10% to all countries. We have 25% on automotive, and we have the additional 20% on fentanyl from China, as well as 25% for Section 301. What are we looking forward in the upcoming weeks? 50% on all copper imports, and potentially up to 200% on pharmaceutical goods under Section 232, and that's going to be announced on August 1st. I mean, it's not a fact yet, but it's a possibility that was announced at the beginning of this week. There were letters sent to 14 countries, including Japan, South Korea, Thailand, Bangladesh, with tariffs set at the same levels or more as the initial Annex 1 list that was published in April. And those tariffs are ranging from 25 to 40% for each country. So stay tuned, because there will be a lot coming up during the summer. Now, moving on to healthcare specifically, LeAnn, what is happening with this industry?
All right, well, definitely some concerning stats that you're sharing there. So we'll touch and refer back to some of those as I move into the presentation. What I thought I'd do at first, though, is just start with a macro view of healthcare. So on the next slide, this is an overview of what we in healthcare call the quintuple aim. If you're exposed to healthcare, back in 2008, three gentlemen got together, Don Berwick, Tom Whittington, and Tom Nolan, and they coined the phrase the triple aim. And in healthcare, that helped us focus our efforts on the outcomes of the care we're delivering, the quality and safety of that care. It also brought our focused attention to the patient's experience. And we're trying to have that high quality care, that excellent experience for the patient at an affordable cost. In recent years, we've added a couple more points to this and calling it the quintuple aim now, where we're also focused on workforce well-being and the equity for the services that we're delivering. On the next slide, the reason I give you this frame of reference is that whether you're a health system or you get care from a health system, or your customers are serving hospitals, clinics, ambulatory surgery centers, you can anticipate what the strategic priorities are of our health systems. Most of them, even if you don't have visibility to their strategic plan or their strategic priorities, you can anticipate that they're in the areas of quality and safety, the patient experience, economic performance, workforce well-being, and health equity. I've added on this slide research and education, because in our environment today, we're observing that a lot of community health systems have now partnered together with academic health systems. So there's an element of research and education in a lot of health systems these days. On the next slide, I provide you with some examples. So these are the types of priorities and the things that we're focused on when we're on the delivery side of healthcare. HAIs are healthcare or hospital-acquired infections. And so I see, the acronym soup there, but they're different types of infections, whether it's urinary or bloodstream or surgical site infections. But we're very aware of any risk we're creating to the patient. We also want to keep them safe. We want to be effective so that they're not readmitted to the hospital after they're discharged. LOS stands for length of stay. We want them to be as efficient as possible when they're in the hospital. There are also many ambulatory or outpatient or clinic quality metrics that we monitor, like diabetes or childhood immunizations, tobacco use, cancer screenings. So those are the types of quality and safety things that we're looking at on a regular basis in healthcare. Also with the patient experience, any of you who've had a healthcare delivery experience in the last months or years, you can hardly leave the doors of that facility without getting a survey and your provider asking you, what was your experience like? All of us in healthcare are very focused on our economic performance, oftentimes measuring our operating margin. And then on the next slide, just concluding these different key priorities for us around workforce well-being. We've long looked at employee satisfaction survey results, which are still important. But these days we're looking at turnover and retention, because we know with all the labor shortages so many of us are experiencing, it becomes important for us to keep our good staff and keep them satisfied in their jobs. We're also very focused on injury or safety, noticing that there are a lot of things that compromise safety for our employees, and we want to reduce any work-related injuries. I mentioned that research and education. So oftentimes we're trying to enroll as many of our patients as possible in clinical studies so we can continue to improve the care we're delivering. And we'll have these learners on site, and we wanted to monitor their experience, because those learners, whether they're residents and fellows going out of medical school, nurses, pharmacists, respiratory therapists, we want them to have a good experience inside of our health systems so that they want to come and work for us. And health equity being this final priority that I'll talk about for health systems, this became very apparent during the pandemic that we were not necessarily reaching to the patient populations that we intended. We weren't reaching those diverse populations, those underserved populations. So we've had a lot of effort in recent years to improve that reach for us into the communities we intend to serve. Next slide. So that kind of gives you the background of the type of world that I live in on the provider side or the hospital side or the health system side. Now I'll move forward to talk about some different elements of the landscape, kind of related to what Valeria was talking about earlier. In addition to all those details of the percentages of the tariffs and different regulatory requirements that are out there, in healthcare, we have to be thinking about it from the different sectors that we buy from. Lots of medical devices, everything from hip and knee implants to cardiovascular devices, suture, bandages, the whole realm there, and the different tracking things that are in place to make sure we're having appropriate devices come into our organizations. Personal protective equipment became very common knowledge during the pandemic. Where are we sourcing those products from? It was common for us to get them from Asia, and then as the pandemic and we had that global demand on all those products, we've had much more diversity in now where we're buying those products from and trying to do more domestic manufacturing there. The pharmaceuticals, as Valeria mentioned, that potential for a 200% tariff on that, and the active pharmaceutical ingredients, the APIs, the component parts of those. On the health system side, we're very concerned about what that's going to do to the price of the drugs that we're purchasing. Food service, not only the actual food, but if you think about it as an example with enteral nutrition, the nutritional products that we deliver via syringes, thinking about what's going to happen, how are we going to buy those syringes in order to feed those who need alternate ways of getting that nutrition. Our capital equipment and projects, we already were used to an incredible lead time to get capital equipment, that particularly that which is manufactured in other countries. But now with the tariffs and the port congestion and that sort of thing, a whole different set of factors that we need to deal with. And finally, I'll mention just the packaging for all these products. There are impacts from the tariffs and regulations and raw materials that affect the packaging that leads to us getting our final products. In the next slide. So let's talk about a little bit in healthcare, our supply chain is extremely vulnerable. I was amazed by the statistic when I read it from the Premier special report that they published in April. We have a very heavy dependence on our global suppliers, but I did not realize that 69% of the US marketed devices that we purchase are manufactured exclusively outside of the US. So all those numbers that Valeria was mentioning earlier have the potential to have a huge cost impact for us. We also, in healthcare, like many other industries, have very high standards and complexity around our regulatory requirements. The next point there about just-in-time models, I would say prior to 2020, COVID-19 and the pandemic, many of us were moving in the direction of just-in-time inventory models. We have since learned with all of the product disruptions, this is no longer a sustainable model. So we might still try and utilize some of the important reasons for using a just-in-time, but these days many of us have safety or buffer stock, buffer inventory available in other locations to support our current needs. And I'll probably repeat this a couple times in this presentation, but the products we use are literally life and death. So it's critical for us to make sure we have on hand what's needed to care for our patients. And as a result of that, it's led to a whole new set of resiliency considerations that we put in place in healthcare. So what's changing? Valeria gave us a great overview of what's happening with the tariffs. What this leading to is for us to have much more transparency of cost with our supply partners, understanding line by line, what's the cost of the materials, the tariff, the transportation. So it's leading to a lot better relationships with us, especially with those suppliers that are willing to pull back the cover that overlays all of that and allow us to understand better what those costs look like. I can tell you, I've been in this business well over 30 years, and in the past, I had no idea where the products came from. But these days, we need to know about that country of origin and what sort of risk or exposure that creates for us. And with these tariffs, it's also creating delays in customs, and then us sometimes not even understanding the invoice and the different line items on there as different supply partners are trying to incorporate that cost into our bills. Also, what's changing in the European Union, we have a whole new set of regulations, the medical device regulations that govern everything from clinical investigation to production to distribution relating to medical devices. And then globally, we're still trying to make a dent in what we call UDI, or the unique device identification. And this is helping us to understand through the entire life cycle, whether it's from the raw materials being going into the component device, the component materials, the finished goods that we're receiving, but we want to know everything about them. So we know the lot numbers, the expiration dates, the serial numbers, and can monitor this very importantly for patient safety as it might relate to a recall, but also just to increase our efficiency around the supply chain. Okay, so I've mentioned tariffs several times, and Valeria gave us the lowdown on that, but it's not just the tariffs. There are all kinds of other logistics disruptions. We've heard a lot about the port congestion, whether it was out in California. We also know about the severe drought that's affecting the Panama Canal. So we have to keep an eye on all of these shipments. And this is something that on the provider side, on the hospital side of things, I never used to have any awareness of that. But now it's important for us all to be aware. The air freight prices, the rising fuel costs, even finding drivers to drive the trucks that have our critical materials, our critical products on it. And then I mentioned packaging before. So now we're also experiencing shortages due to the resin to make that packaging material. So we just have to be paying attention to everything these days. But the good news is I have observed many good resiliency strategies that we've put in place. So I'll mention a few of those to you, starting with a case study. And this is a bit of an old case study. It really did come out of the pandemic. But we know that there was a global spike in demand for the N95 respirator masks and gowns. And so definitely a huge problem there. And as health systems, we imposed several different solutions. We created different regional warehousing strategies with buffer stock or safety stock in those warehouses. We partnered well with our group purchasing organizations. and found ways to guarantee the allocations to make sure it could meet our expected demand. We even had examples of chartering emergency cargo shipments to get these products to us. I remember an example where I approved a purchase order for $2 million just to get the face masks from a vendor I had never met before. And so we used to have to take chances on this. The good news is we built this into our resiliency models now, so there's not these risks we're having to take like we did through the pandemic. But in this example, we reduced our back orders by 80%, and I actually think it strengthened the relationships that we have with our suppliers as we've worked much more closely together. On the next slide, some more tailored logistics strategies that we've used. Prior to the pandemic, many of us on the health system side were trying to put more sole source agreements in place because we thought this served us well from a supply chain efficiency and especially from the cost that we could drive down with those sole source agreements. But these days, with all of our product shortages, it's much more common for us to have dual source sourcing strategies in place and monitoring where these products come to us from. So many more nearshoring. We still have a lot of offshoring, but onshoring, that's just become a whole new language that we're living with every day. The next piece is the importance of scenario planning and predictive analytics. So many of us on the provider side are hiring talented analysts or training ourselves to become effective analysts so that we can be planning, monitoring these analytics and predicting where those shortages will exist. And there are a couple of examples of trading partners that have come together. One is HERC. It stands for the Healthcare Industry Resilience Collaborative. And it's provider health system customers partnered together with suppliers, distributors, manufacturers, and even creating a resiliency badge so we can know what should those suppliers be looking at and how can you share that information with your customers. Another example is called SMI, which stands for Strategic Marketplace Initiatives. And they've created a resilience maturity model that's a neat way of doing a self-assessment, but also understanding how you're performing today and then what steps can you take to get even more mature as it relates to how you're addressing resiliency. Another example, and this is a debatable topic, but is vendor managed inventory, or on the hospital side, we often refer to it as consignment. And this is where we will partner together with our supplier and actually ask that they continue the ownership and manage that inventory on site in our hospitals. Some like that because it doesn't hit our books until it's actually used. But there are other hospitals that would prefer to control that. And so at times you'll see that as a strategy that some hospitals want and others prefer to have that direct management of their inventory. And finally, the integrated logistics visibility. Again, this is a whole new thing. This is an example where Oversee, our host for this webinar, has great tools, but we want that real-time tracking. We want to know where our products are, where they are in as they're moving to us and when they will arrive. And then we want effective exception management tools to help us address anything that might have a disruption while it's on the way to us. And then, the regulatory environment. So it's tricky for us all to navigate these different regulatory requirements. But what we've done on the health system side, we've actually built compliance into our sourcing processes and our decisions. And we're regularly monitoring all of these regulations, some of them that I mentioned earlier, like the MDR in Europe, our federal drug administration, that unique device identification, environmental, social governance, reporting requirements. It's all these acronyms, just a part of our daily language these days. We're also doing a lot more collaboration, both with legal and trade experts, so that we can understand what we need to know that affects our entire sourcing process. And finally, it's doing some great things around automation. So these days, there's a lot of friction with how we manage customs, but there's new tools that are available to help us more efficiently get those products through customs. On the next slide here, I'll give one more case study. So a medical device manufacturer. We've talked about the huge tariffs from China. The example in this was with this supplier having many of those key device components made in China. The supplier did a rapid assessment of their supplier base and actually shifted some of those to a Vietnam-based component supplier and applied for US tariff exemptions. Now, what this resulted in is actually a delay in getting the products here, but the long-term gain is really a more diversified supply base and improvements in cost containment. Next slide. There we go. So I created a quick checklist here. These are some of the things that we're thinking about. On the health system side, we need to have knowledge of what are our most critical supplies, and we have to have alternatives approved and ready to go should there be disruption to our critical supplies. We've also made efforts to diversify our supplier base. These days, it's part of a core competency for us, incorporating resiliency into all of our sourcing and contracting processes. We conduct regular risk mapping and review our trade exposure. We're investing in those end-to-end visibility tools, whether it's with a third party like Oversee, or it could be us buying our own tools to monitor that. Collaborating with our suppliers much more around transparency related to the country of origin, what their disruption status is, which is a difficult thing for suppliers to share because their fear is going to be if they tell us about that disruption, we might go to an alternative supplier. But it's much more important these days that we have that visibility about those disruptions. And then I've mentioned a couple times that we have that knowledge of the exact cost and how that will come through to us. And finally, on the health system side, we leverage the tools that are available from our group purchasing organizations and different trade associations. So I'll leave you with just a couple of thoughts and we'll move into the question and answer. I see we've got a couple comments, but if you want to put your questions into the chat, we'll address those. So my final thoughts around tariffs and regulations, they're definitely not going away. So what we need to do is have that resilience as a core competency in the work that we're doing every day. And I've mentioned healthcare's mission is critical. This is life or death. And so we need to have smarter logistics, better forecasting, and find the right balance for us in our global and local sourcing decisions. And with a couple of generic case studies that I just mentioned, we do know that if we have the right strategies in place, we can overcome these disruptions and, in fact, maybe see those as opportunities to become more efficient in the long run. So I'll pause there. Valeria, I do see one question there. Did you want to add any comments or should I go ahead and take on that question?
Yeah, thank you, LeAnn. Let me read the question. It says, is the 50% tariff on steel and aluminum only on the raw material coming into the US from other countries, or is it being applied to products as well, such as aluminum crutches and walkers? Yes, it's being applied to the components of steel and aluminum. So it's not only the raw material, but whatever the product has of steel or aluminum. Hopefully.
And if I can add to that, Valeria, so that's where it becomes important. I love the examples there, the aluminum crutches and walkers. So those are products that we are going to buy. But it will be important as the manufacturers are experiencing that tariff and that increase to them, that we understand what portion of that are you passing through. As the health system customer, we don't just want a general line item that says tariffs and 45%, because we know that's not the total impact to the supplier. And as the customer, we're going to look for some sort of sharing in that, because those tariffs weren't meant to just increase the price to the ultimate buyer of that end product.
Exactly. Yeah, and you have to know also the value of those components of steel and aluminum so that you can declare them before customs authorities. So yeah, you have to be very exact with the information that you provide to CBP. Then next question is, are there any exceptions for duties on medical devices being used in the surgical and post-op settings for patient safety? Yeah, So there is a list, exactly as Greg is mentioning, is that's where I was going. Annex 2, you can check the list of HS codes where there's the exceptions for the tariffs. So if your HS code is there, it's going to be exempt for the amount of duties. I don't know if there's any other questions or anybody would like to comment anything
if I can just add as well, for the audience, if there's anything that I can do to support any of you with your questions, if you get the slide deck or my contact information is out there. I am on LinkedIn. I'd love to hear from you with any feedback on the session as well. So I'll just put that little plug in there. Thanks.
Thank you, LeAnn. I'm pretty sure our audience will reach out to you if any questions. And yeah, I don't think we don't have any other questions. We're also available. The team at Oversee is also available for any questions. You can reach out to your sales representative or myself. I'm also on LinkedIn, so you can find me as Valeria Carvajal. And I think if there's no other questions, we're about to finish right on time. Okay, perfect. Thank you everyone for joining, and hopefully we'll see you in the next webinar. Have a nice day. Thank you, LeAnn. Bye-bye.